Hi, my name is Nicholas Stone, and today I'll be discussing the PRECEDE-PROCEED planning model in regards to the case study, key components in planning, implementing, and monitoring a behavior change communication campaign that increased condom use among male clients of sex workers in southern India. The objectives for this presentation are to describe how the condom use promotion program followed the principles of the PRECEDE-PROCEED model, address how to determine which behavioral theory to guide the process in the third phase of the PRECEDE-PROCEED model, and determine what was omitted from the community-based participatory research model compared to the PRECEDE-PROCEED model. So there are 8 phases of the PRECEDE-PROCEED model. The first 4 falling under PRECEDE and the latter 4 under PROCEED. Phase 1 of the model is social assessment, where it's determining the target audience's perception of their own needs and quality of life. And the planners conduct a multi-data collection in this phase. And so this is initially done for this case study with surveys at the beginning, and then throughout the case study they also conducted more surveys. They did focus groups and several questionnaires. And then phase 2, the epidemiological, behavioral, and environmental assessment, determines which health problems are most prevalent within specific target populations and sets priorities and begins to draft the program's goals and objectives. So the priority set during this phase for the case study was to increase the percentage of the target population that reported consistent condom use with commercial sex partners in the previous 12 months from 62% to 69%. Phase 3, educational and ecological assessment, is where we identify the behavioral and environmental determinants or risk factors for the health problem that was identified in phase 2. It's a good idea here to select one or more behavior change theories in which to base the program's interventions. For this case study, they actually developed their own behavior change framework, um, but it drew on a variety of theories, including social learning theory, theory of reasoned action, theory of planned behavior, and the health belief model. And then phase 4, administrative and policy assessment and intervention alignment. So you select and align the program's components with the priority determinants, identify resources, organizational barriers and facilitators, and policies that are needed for program implementation and sustainability, and write measurable objectives. So at the start of the program, most male commercial sex clients were using condoms. A May 2006 PSI baseline survey on condom use found that 62% of male clients of female sex workers reported using a condom consistently in the previous 12 months. Only 2% reported never using a condom, and 3% reported not using condoms at all in the last 12 months. So they aligned with phase 4 by determining the 4 beliefs about condom usage that align with their intervention, and setting up offices and hiring staff in the 100 priority towns. And for measurable objectives, we already discussed how they plan to increase consistent condom usage to 69%. And then they also decided to measure reach and recall. So then that brings us to the proceed step. So starting with phase 5, implementation. Health promotion program is ready for implementation, and data collection plans should be in place for evaluating the process, impact, and outcome. So we talked in phase 1 about how they use focus groups and questionnaires throughout the process, and surveys as well, to determine the reach and recall. And so they determined that a goal of reaching 40% of the target audience 6 times a year was reasonable. However, there was a lack of an exact number of male clients using sex workers, and and they had uncertain monitoring records, which made it difficult to determine the reach. So they developed an equation based on the percentage of male clients surveyed who recalled seeing each activity, which said for every 100,000. So now let's discuss using an established behavioral theory for phase 3 of the PRECEDE-PROCEED model. So why do we want to use an established behavioral theory? So that's because it can help keep an intervention on track and will save time and effort in the planning and development processes. And so how do we know which theory to use? That really depends on the goal of the intervention. So each theory has its own unique pros and cons, and they should be weighed to help you best reach the desired outcome. Now let's look at the community-based participatory research model and compare it to the PRECEDE-PROCEED model. So CBPR is a partnership approach between the community and the researchers. So PRECEDE and PROCEED only involves the community in determining their perception of their own needs and quality of life. Whereas the things that are omitted from the CBPR model in the PRECEDE-PROCEED model are that the CBPR model allows community members to help guide intervention development, and then it also helps, it has the community members help assist with interpretation, dissemination, and translation of findings. So overall, I think the case study does a good job of following the PRECEDE-PROCEED model. They really only stray in those last few phases, phases 6, 7, and 8, where they still conducted everything that was included in those phases. They just didn't separate them into their separate components. Thank you for following along with this presentation. If you are interested in reading the case study, here's a reference for it.